Dr. Adrian, what's the process of getting a whole new set of teeth?
Okay, but we really have two types of patients that usually come in. We've got patients that have had dentures for a long time. One of the main issues with dentures is that they always function very well, and historically people that have dentures for a long period of time. What actually happens though is when you lose your teeth, the bone in the gum starts to shrink. A person that's worn dentures for a very long period of time will find that their dentures function very well when they started. As they're getting older, what happens is the bone in the gum starts to shrink and these dentures get heavier and heavier and they start to drop. So they're looking for some sort of solution to get rid of their dentures. So that's one group of people. The other is those that have been told by a dentist that their teeth are no good. They can't save their teeth. They're basically what we call terminal dentition. And those patients are looking for an option to avoid having dentures, or they may have heard about the bone loss or the face changes or something like that. So what we're talking about here is a system called All-on-4, which has now been around for about 15 years. And what it is replacing all of the teeth fixed in the mouth, so that's 12 to 14 teeth, on only 4 implants per jaw. So the patient will come in and it will normally only take 3 to 4 days, so it's a very short period of time. We do a lot of diagnostic work before then, so we'll get the patient in, and again, with getting a new smile, we'll talk about the shape and the colour of the teeth, and they'll get to choose all of that. And then what we will do then is on day one, they will come in and either they will have their teeth out, or if they're denture patients, they'll actually have the implants in, so teeth out, implants in, and they would then go home. And that's usually done while the patient's asleep. Wow. On day 2, we do what we call a try-in, so they'll actually come in and we'll try their new teeth in. And what we're checking is really 2 things. Can they chew well, so is their bite right? And secondly, how do they look? Okay, so on day 2 is really their trial run of what their new teeth is going to look like and also function. And then on day 3 or 4, what normally happens is they will come in and we will actually screw their new set of teeth in. So it's a very short process to actually do, but the deciding factor on whether we can do this treatment is actually whether they have enough bone, because naturally implants can only be placed if patients have bone. And we already talked about denture sufferers, the fact that sometimes with bone loss, they're unable to have implants. So at the very start of treatment, we always will look at their bone and we will normally send them for some sort of scan of their bone, and we will always check whether they have enough bone first before we recommend any sort of implant treatment.